Hello and welcome to today's video. In today's video, we're going to discuss a very common issue, that is sensitive teeth. It is estimated that 1 in 4 people suffer from sensitive teeth at some point in their lives. So let's look at the different causes for sensitive teeth and how we can manage them. Sensitivity can be quite uncomfortable. It usually manifests itself as a short, sharp pain or a twinge when exposed to different stimuli. This could be either cold or hot or even sometimes just air. This happens when the second layer of the tooth, that is the dentin, is exposed. Severity may vary from patient to patient. Sensitivity could be just due to one cause or due to many causes or multifactorial in nature. So let's look at 8 common causes and see how we can manage them and prevent sensitivity from becoming worse. Cause number 1 is abrasion. Abrasion usually occurs due to faulty toothbrushing technique. This could be if you're scrubbing your teeth too hard or using a very hard bristle brush. Now, when you do this, you end up wearing out the enamel of your teeth, and hence the underlying layer, the dentin, is exposed, leading to sensitivity. So the best way of managing this is to switch to a soft or an ultra soft bristle toothbrush and use things like desensitizing toothpaste to manage symptoms. Cause number 2 is erosion. It is estimated that 1 in 3 people in the United Kingdom suffer from erosion. Erosion is basically the loss of enamel due to very acidic food such as fizzy drinks, wines, pickles, lemon tea, etc. It has become increasingly common nowadays because more number of people are sipping flavored water, fizzy drinks, or cordials throughout the day instead of plain water. Erosion can also occur if one suffers from acid reflux or frequent bouts of vomiting or eating disorders such as anorexia or bulimia. So the best way to manage erosion is to identify the cause. Identify the acidic foods in your diet and try to limit them. If you have anything acidic at all, make sure you rinse your mouth immediately after. And it's best to avoid brushing your teeth straight after eating anything acidic. Wait for at least an hour or maybe 2 and then brush your teeth. Also, make sure that you see your dentist on a regular basis. When you go to your dentist might take a few measurements. This is just to assess the severity of erosion and to monitor it over a period of time. So as you see your dentist over a period of years, your dentist will be able to tell you whether your erosion is getting worse or if it's stable. The third cause is gum recession. Now, this term is used when your gums pull away or shrink, exposing more amount of tooth structure. This can lead to exposure of the root of the tooth, which is quite sensitive, and this area does not have a thick layer of enamel around it to protect it. Gum recession can occur naturally based on the anatomy of the tooth or the position of the tooth, or also could be due to a traumatic bite. It can also occur due to orthodontic treatment, so that's after you've had braces. There are various factors that could lead to recession, so it's best to see your dentist to get that assessed. Now, the best way to manage it is to use a desensitizing toothpaste if your teeth are sensitive, or you could also use something known as tooth mousse. Cause number 4 is gum disease. So when you suffer from gum disease, there can be loss of supporting structures around the tooth due to bacterial activity. This can also lead to exposure of the root surfaces, which also can lead to sensitivity. So the best way to tackle gum disease is to maintain good oral hygiene. So make sure you're brushing twice daily, using a mouthwash on a regular basis. Try and clean in between your teeth, use any interdental aid that's available, and see your dentist regularly. Cause number 5 is tooth whitening. Some patients develop sensitivity either during or after the whitening procedure. Now, make sure that when you're whitening your teeth, you're doing it under the guidance of a dentist. If you use very high concentration of the bleaching agent, you could end up damaging your teeth as well as gums. So make sure that you're using the right concentration and using it as directed. If you do develop sensitivity while using the home whitening kit, then you could try and use desensitizing toothpaste in your trays instead of the gel and leave it in the mouth for 30 minutes to 1 hour. See how it goes. You may have to repeat it for a day or 2 till the sensitivity eases. Cause number 6 is teeth grinding or bruxism. Many people tend to grind their teeth at night or even clench their teeth during the day. Now, this leads to loss of enamel and exposure of the underlying layer, that's the dentin, which leads to sensitivity. This is usually not limited to one tooth, but usually affects multiple teeth or maybe all the teeth in the mouth. Now, many people are unaware whether they grind their teeth at night or not. The best person to answer that would be your sleep partner. So we will cover bruxism in detail in another video where we can discuss the causes, the management and the different therapies that are available. Cause number 7 is dental caries or a hole in your tooth. Now, if that is the case, make sure you see your dentist as soon as possible. In the meanwhile, make sure you limit sugary snacks, rinse your mouth thoroughly with warm salty water, do this twice a day, and maintain good oral hygiene. Cause number 8 is a cracked tooth. Now, sometimes with cracked teeth, you may not have mobile fragments. You may just have a crack and the tooth may still be intact but could be symptomatic. So if that's the case, it's best to see your dentist as soon as possible. Now, if you've got asymptomatic, very minor grazes or very faint cracks on the teeth, it might be okay to leave it alone and monitor it for some time. Hope you found this video useful. Do subscribe for more such videos and see you soon in the next video.